Welcome to our episode number 9 of our series of 12 appliances that we are using, where you are learning in each episode about a different appliance. Our episode 9 features an appliance that is one of the most used in the world for the treatment of class 2, and it is an appliance that after this appliance, many other appliances came out like the Bionator. So if you still don't know the Andresen Activator, it would be the father of all other appliances that correct skeletal class 2 due to mandibular deficiency. Let's learn how the Andresen Activator appliance works. This is one of the appliances that I like the most for treating class 2 with mandibular deficiency in patients who have skeletal problems. The Andresen Activator appliance has a structure that encourages the patient to use the appliance because it doesn't remain loose in the patient's mouth. So, imagine that your patient is someone who has an increased overjet class 2 due to mandibular deficiency, and therefore is indicated for this use. So, what are the important characteristics? Number 1, that this appliance always has retention hooks. So, I need these retention hooks to hold the appliance in the patient's mouth. I even like them to have small drop-shaped hooks in this area that further aid in the retention of the appliance. Another point would be the vestibular arch. To activate this vestibular arch, we always use our bird beak pliers. We place the rounded part of the bird beak pliers on the inside of the loop and close the loop. This always helps us to centralize this vestibular arch in the center of the incisors, or suddenly we can also place the most incisal part of these upper incisors to help create the lingualization effect. It is important that the Andresen Activator also includes the expansion screw, which helps to achieve expansion within the lower and upper arch. We also have this acrylic that can be worn down to correct the overbite, all in a single appliance. Notice that there is an immediate improvement in the profile as soon as the patient places the appliance inside the mouth. And then we continue with the control until there is neuromuscular adaptation and the jaw is positioned in the centric relation in a more anterior position. It is an excellent appliance. And for those of you following the appliance series so far, we are at number 9. This week we will still release number 10. But if you don't know, today we have our class number 2 of our big event happening this week. These are intense classes, and today we have our class number 2, which will soon go off the air. So, come to class number 2. I will leave the link here in the video description, so you can follow the sequence of classes that I am explaining, not only about the Andresen Activator but many other appliances to correct class 2. I'll see you in today's class.